Most people over 65 are taking medications they don't need, because the real cause of their declining heart and brain function isn't cholesterol, isn't blood pressure, and it isn't genetics. It's how they breathe. That sounds absurd. You've been breathing your whole life. If breathing were the problem, you'd have noticed by now. But here's what nobody tells you. The way most adults breathe changes dramatically after age 60. And that change quietly accelerates cardiovascular disease, cognitive decline, and the kind of fatigue that makes people assume they're simply getting old. You're not simply getting old. You're overbreathing, and it's starving your heart and brain of oxygen. Here's the paradox that took researchers decades to accept. Breathing more air does not mean more oxygen reaches your tissues. It means less. This is called the Boer effect, discovered in 1904 by Danish physiologist Christian Boer, the father of Nobel laureate Niels Bohr, and it remains one of the most underappreciated findings in all of physiology. When you exhale too much carbon dioxide through rapid or heavy breathing, your red blood cells tighten their grip on oxygen molecules. They refuse to release that oxygen into your heart muscle, your arterial walls, your brain tissue. The oxygen is there, riding in your blood, but it cannot get off the bus. Carbon dioxide is not just a waste gas. It is the primary trigger that tells hemoglobin to open its hands and release oxygen where it's needed. When your breathing rate is chronically elevated, even slightly, even by 2 or 3 extra breaths per minute, you chronically reduce the carbon dioxide in your bloodstream, and your tissues chronically receive less oxygen, despite the fact that your blood oxygen saturation on a pulse oximeter looks perfectly normal. The oximeter shows you the oxygen is in the blood. It cannot show you whether that oxygen is being delivered. This is why many people over 65 with perfectly acceptable oxygen saturation levels still experience brain fog, exercise intolerance, cold extremities, dizziness on standing, and the slow mental dulling that gets labeled as age-related cognitive decline. Their tissues are functionally hypoxic, starved, not because they aren't breathing enough, but because they're breathing too much in the wrong pattern. There are 3 specific breathing dysfunctions that become significantly more common after 60, and each one damages the heart and brain through a distinct mechanism. By the end of this, you'll know all 3. You'll understand exactly what's happening in your body when they occur, and you'll have a precise, clinically supported breathing practice you can begin today that addresses all 3 simultaneously. But I want you to understand something before we get there. The reason this information has never reached you through your doctor's office is not negligence. It's specialization. Cardiologists study the heart. Neurologists study the brain. Pulmonologists study the lungs. Nobody in mainstream medicine is trained to look at the breathing pattern as a unified system that governs all 3 simultaneously. That gap is what this video closes. The first dysfunction is chronic thoracic breathing. This means breathing primarily into the chest rather than the belly. Watch yourself in a mirror right now. Take a breath. Did your chest rise first? Did your shoulders lift slightly? If yes, you are a thoracic breather. And after 65, that pattern carries serious consequences. The diaphragm is a dome-shaped muscle that sits beneath your lungs. When it contracts properly during inhalation, it presses downward and outward, creating negative pressure that draws air deep into the lower lobes of the lungs, which is precisely where the majority of your lungs' gas exchange surface area is located and where blood flow from the pulmonary circulation is most concentrated. A full diaphragmatic breath utilizes roughly 75% more alveolar surface area than a shallow chest breath. That means 75% more opportunity for oxygen to cross into the bloodstream and for carbon dioxide to be properly balanced. But the consequences of chest breathing go beyond gas exchange. The diaphragm is intimately connected to the vagus nerve, the longest cranial nerve in the body, responsible for regulating heart rate, blood pressure, digestion, and the inflammatory response. When the diaphragm moves fully with each breath, it mechanically stimulates the vagus nerve. This stimulation activates the parasympathetic nervous system, dropping heart rate, widening blood vessels, reducing cortisol, and pulling the body out of the low-grade fight or flight activation that is epidemic in older adults, and that is now recognized as a primary driver of arterial inflammation, plaque formation, and atrial fibrillation. Chest breathing does the opposite. It activates the sympathetic nervous system. It keeps cortisol elevated. It maintains a state of physiological alertness that, over years and decades, erodes. The arterial endothelium, the delicate single-cell thick lining of your blood vessels that regulates everything from clotting to inflammation to how easily your arteries dilate and contract. When that endothelium is chronically stressed, it becomes dysfunctional. Dysfunctional endothelium is the foundational lesion of cardiovascular disease, not cholesterol, not fat in your diet. The endothelium losing its ability to self-regulate because it is being bathed in the cortisol and inflammatory cytokines generated by a nervous system that never fully exits the stress response, and it stiffens the heart muscle itself. The left ventricle, which pumps oxygenated blood to your brain and body, becomes less compliant with chronic sympathetic overactivation. It fills less effectively between beats. Cardiologists call this diastolic dysfunction a stiffening of the heart's filling phase, and it is the cardiovascular finding most commonly identified in adults over 65, often labeled as age-related, when in fact it is breathing pattern-related and profoundly reversible. The second dysfunction is mouth breathing. After 65, the incidence of habitual mouth breathing increases sharply, largely because nasal congestion becomes more common as mucosal tissues lose elasticity, and because the habit of mouth breathing during sleep is almost universal among people with any degree of sleep-disordered breathing. The damage from this single habit is staggering and almost entirely unacknowledged in mainstream medicine. Your nose is a precision instrument. It filters particulates, humidifies incoming air to protect delicate alveolar tissue, warms cold air before it reaches the bronchial tree, and this is the critical part. It produces nitric oxide. The nasal sinuses, particularly the paranasal sinuses, are prolific producers of nitric oxide, a signaling molecule that performs functions in the cardiovascular system, so important that its discovery won the 1998 Nobel Prize in Medicine. Nitric oxide produced in the nasal passages travels with inhaled air directly into the lungs, where it causes pulmonary vasodilation, the widening of the blood vessels in the lungs that allows more blood to flow through and be oxygenated. It then enters systemic circulation and tells the smooth muscle lining your arteries to relax, reducing vascular resistance, lowering blood pressure, and dramatically improving circulation to the heart and brain. It also inhibits platelet aggregation, meaning it actively reduces the tendency of blood to form the clots that cause heart attacks and strokes. Additionally, nitric oxide has direct antiviral and antimicrobial properties in the upper respiratory tract, making it a first-line immune defense that mouth breathers routinely forfeit. When you breathe through your mouth, you bypass the sinuses entirely. You produce almost no nitric oxide. You deliver cold, dry, unfiltered air to your lungs, and you lose a compound that your cardiovascular system depends on for normal function. Studies have shown nasal breathing increases blood nitric oxide levels by as much as 6-fold compared to mouth breathing. For someone over 65 whose nitric oxide production is already declining with age, because endothelial nitric oxide synthesis decreases progressively after age 40, mouth breathing is cardiovascular vandalism. It is the equivalent of turning off your body's internal blood pressure medication and clot prevention system simultaneously every hour of every day that you breathe incorrectly. There is also a structural consequence to chronic mouth breathing that nobody talks about. The tongue's natural resting position is against the roof of the mouth. When you breathe through your mouth habitually, the tongue drops to the floor of the mouth. The jaw muscles alter their resting tension, and the airway actually narrows, which paradoxically increases the effort required to breathe and further promotes chest-dominant breathing as your respiratory muscles compensate for reduced airflow efficiency. It becomes a self-reinforcing cycle of dysfunction that gets worse every year without deliberate intervention. The third dysfunction is breathing rate dysregulation. A healthy adult at rest breathes between 5.5 and 6.5 times per minute. This is the number that emerges consistently in research on cardiovascular coherence, athletic performance, and meditative states across cultures. Most adults over 65 breathe between 14 and 18 times per minute at rest, more than double the optimal rate. That hyperventilation chronically depletes carbon dioxide, triggers the sympathetic nervous system, prevents full vagal activation, and means the heart and brain are never receiving the deep, rhythmic parasympathetic washout that occurs during slow breathing. The medical literature has known about resting breathing rate as a mortality predictor for decades. A 2013 meta-analysis published in the British Medical Journal found that elevated resting respiratory rate was among the strongest independent predictors of cardiovascular mortality in adults over 60, stronger than resting heart rate, stronger than cholesterol, and comparable in predictive power to smoking status. A resting respiratory rate above 20 breaths per minute in an older adult is a recognized clinical warning sign. Yet most doctors never measure a patient's breathing rate. They measure heart rate, they measure blood pressure, they take blood samples. But they never simply count how many times the patient breathes per minute while sitting in the waiting room, which would take 30 seconds and would tell them something profound about that patient's cardiovascular risk. Here is what makes slow breathing so specifically powerful for the aging cardiovascular system. Your heart rate naturally fluctuates with every breath. It speeds slightly during inhalation and slows during exhalation. This fluctuation is called heart rate variability, and it is one of the strongest predictors of cardiovascular health and all-cause mortality ever identified. High heart rate variability means your nervous system is flexible, responsive, and adaptive. Low heart rate variability, the kind associated with rigid fast breathing patterns, predicts heart attack, stroke, sudden cardiac death, depression, and cognitive decline with a statistical consistency that has made it a gold standard biomarker in cardiology research for over 30 years. When you breathe at approximately 5.5 breaths per minute, something remarkable happens. Your breathing rhythm and your heart rate variability synchronize. This is called cardiac coherence or cardiovascular resonance, and it is a state in which the baroreflex, the feedback system your body uses to regulate blood pressure, operates at peak efficiency. Blood pressure regulation becomes more precise, cardiac output becomes more efficient, cerebral blood flow increases, the prefrontal cortex, the brain region most vulnerable to aging and most associated with memory, judgment, and emotional regulation, receives a measurable surge in oxygenated blood. Researchers using functional MRI have documented increased prefrontal activation during slow resonance frequency breathing sessions in older adults, the same brain region that shrinks most dramatically in Alzheimer's disease, showing increased activation during and after as few as 4 weeks of slow breathing practice. In a few minutes, I'm going to give you the precise protocol, the specific counts, the specific ratio of inhale to exhale, the specific progression over 4 weeks. That activates all of these mechanisms simultaneously. It takes 6 minutes twice a day. Multiple peer-reviewed studies have tested it in adults over 65 specifically, and found significant reductions in systolic blood pressure, improvements in cognitive processing speed, reduced markers of arterial inflammation, and measurable increases in heart rate variability after just 4 weeks. You need the full physiological context before the protocol makes complete sense, so stay with me, because what comes next explains why. The exhale is the most critical and most neglected part of every single breath you take. When you exhale slowly, completely, and with slight resistance, meaning slightly slower than your inhalation, you extend the period of parasympathetic dominance with each breath cycle. The vagus nerve responds primarily to the exhalation phase. A short, passive exhale gives the vagus nerve a brief signal. A long, controlled exhale gives it a sustained signal, like holding a switch down instead of tapping it. That sustained vagal activation drops heart rate more substantially, dilates coronary arteries, increases blood flow to the brain, and releases acetylcholine, the neurotransmitter of rest and repair. That counteracts the inflammatory cascade triggered by chronic sympathetic activation. Acetylcholine is the molecule your body uses to apply the brakes to inflammation. The inflammatory reflex, discovered by Kevin Tracy at the Feinstein Institutes, is a neural pathway through which the vagus nerve directly communicates with the immune system, signaling macrophages in organs throughout the body to reduce the production of pro-inflammatory cytokines. When vagal tone is low, as it is in people who breathe fast and shallow, this anti-inflammatory pathway is chronically underactivated. The result is the low-grade systemic inflammation that is now recognized as the common driver of heart disease, dementia, diabetes, and most of the diseases we associate with aging. Slow breathing, by activating the vagus nerve with every single prolonged exhale, turns on this anti-inflammatory pathway with a frequency and consistency that no pill currently on the market can replicate. For adults over 65, the ratio of exhale to inhale is critically important. Research from the HeartMath Institute, from the breathing synthesis work of James Nestor, and from multiple university laboratories studying respiratory physiology in older adults, converges on a consistent finding. Extending the exhale to 1.5 to 2 times the length of the inhale produces the greatest and most consistent cardiovascular and cognitive benefits in aging populations. An inhale of 4 counts with an exhale of 6 to 8 counts is the target range, and that range needs to be achieved gradually, over weeks, to allow the carbon dioxide sensitivity of your chemoreceptors to adjust. Now there is another layer that most breathing guides completely ignore, and it may be the single most important factor determining whether any of this works for you long-term. The state of your airway during sleep determines whether any waking breathing practice can hold. You can practice slow nasal breathing for 10 minutes every morning and then spend 8 hours mouth breathing, snoring, and partially obstructing your airway during sleep, which means spending 8 hours in sympathetic activation, 8 hours producing almost no nitric oxide, 8 hours without the slow-wave sleep breathing pattern that in healthy adults drops naturally to around 5 breaths per minute, and during which the brain performs the metabolic waste clearance through the glymphatic system that prevents amyloid plaque accumulation. The waking practice becomes insufficient to overcome the nightly damage. The glymphatic system deserves more attention than it receives in discussions of cognitive aging. It is essentially the brain's lymphatic system, a network of fluid channels that surrounds blood vessels in the brain and clears metabolic byproducts, including beta-amyloid and tau proteins, the hallmark accumulations of Alzheimer's disease. The glymphatic system operates almost exclusively during slow-wave sleep, when brain cells actually shrink by up to 60%, allowing cerebrospinal fluid to flush more effectively through the interstitial spaces. This process is profoundly dependent on breathing quality during sleep. Disrupted breathing, mouth breathing, and snoring all fragment slow-wave architecture, reduce the depth of sleep stages where glymphatic clearance is most active, and over years, contribute to the toxic protein accumulation that precedes cognitive decline by 15 to 20 years. You have been told that memory loss is inevitable after 65. What you haven't been told is that some significant portion of that cognitive trajectory is determined by how you breathe at 3 in the morning. There is one intervention that addresses sleep breathing directly. It costs under $1 per night. It is supported by clinical research, and I will tell you exactly how to use it. But first, I want to address something most people over 65 have been told that is not just wrong, it is actively harmful to their cardiovascular health. You've been told to take deep breaths when you're anxious or stressed. Take a deep breath is advice so universal. It feels like biological truth, and it is partially correct, but the common execution of it is physiologically backward. Most people, when told to take a deep breath, take a large, fast, forceful inhalation through the mouth, expanding the chest, and then exhale partially or quickly. This is the exact pattern that activates the sympathetic nervous system, depletes carbon dioxide, and triggers the Boer effect oxygen lock. It makes anxiety worse. It drops carbon dioxide, which constricts cerebral blood vessels, the opposite of what a stressed brain needs, and it signals the heart rate to elevate rather than recover. A genuine calming breath, the kind that actually activates the vagus nerve and restores cardiovascular coherence, is a slow, quiet, nasal inhalation that expands the lower belly first, followed by an exhale that is longer than the inhalation, quiet, and through the nose or through slightly pursed lips to create gentle resistance. The sensation should be one of almost not breathing enough. That slight sense of air hunger is the carbon dioxide rising toward its proper level. It feels mildly uncomfortable at first because your respiratory drive, which is governed by C-Otwo sensitivity, has been calibrated to the higher, depleted C-Otwo levels of chronic overbreathing. Within 2 weeks of practicing correct breathing, that C-Otwo sensitivity recalibrates, the air hunger sensation disappears, and slower, quieter breathing begins to feel entirely natural and deeply comfortable. Many people describe their first experience of this recalibration as feeling, for the first time in years, genuinely and profoundly calm. Now we arrive at the complete protocol. This is exactly what the research supports. This is exactly what I want you to do. The breathing pattern is called resonance frequency breathing with an extended low-resistance exhale, and here is precisely how it is performed. Inhale slowly through the nose for 4 counts, not a dramatic inhalation, a gentle, effortless expansion of the lower belly, as if you are allowing air to fall into you rather than pulling it in. No chest movement or minimal chest movement. The belly expands first, the lower ribcage expands outward, and only in the final moment does the chest gently rise. Hold for 0 counts in the first 2 weeks. No breath hold during the initial learning phase, because holds require a baseline of C-Otwo tolerance that builds through consistent practice. Then exhale through the nose for 6 counts. Slowly, completely, the belly falling first, then the chest gently lowering, finishing with a gentle and complete release at the end rather than a forced push. That complete cycle takes 10 seconds, 6 cycles per minute. This is the cardiovascular resonance frequency target. Perform this practice for 6 minutes continuously. Twice daily produces the strongest documented results, once in the morning before any caffeine, and once in the evening 90 minutes before bed. Morning practice primes your cardiovascular system and nervous system for the day. Evening practice lowers cortisol, reduces heart rate, and creates the neurological conditions for deeper, more restorative sleep. During the practice, place one hand flat on your belly below the navel, and one hand on the center of your chest. The belly hand should move noticeably outward on the inhale and inward on the exhale. The chest hand should barely move at all during the first half of each inhalation. If your chest is leading, you are still in thoracic mode. Do not force your chest down with muscular effort. Instead, consciously soften the abdominal wall. Think about letting the belly release forward and downward on the inhale, as if releasing a held-in tension in the gut rather than actively pushing out. This distinction matters. Forcing the belly out is still a muscular engagement that can maintain tension. Releasing the belly creates the true passive diaphragmatic descent that fully stimulates vagal pathways. After 2 continuous weeks of twice daily 6-minute sessions, extend the exhale count from 6 to 8 while keeping the inhale at 4. The Forminus 8 pattern deepens vagal activation and produces significantly greater heart rate variability improvements than Forminus 6, but it requires the C-Otwo tolerance built during the first 2 weeks. Attempting Forminus 8 immediately can cause lightheadedness, not because it is dangerous, but because the carbon dioxide shift is faster than your chemoreceptors are yet recalibrated to handle. Trust the progression. After 4 weeks, introduce the pursed lip exhale modification. This is the technique used in the clinical trials, showing significant blood pressure reduction in older hypertensive adults. And it is simple. During the exhale phase, hold your lips in the shape of blowing out a candle very slowly, not forcefully blowing, but a gentle continuous breath through a small lip opening. This creates gentle back pressure in the airways, keeps small airways open longer, improves alveolar gas exchange efficiency, and naturally prolongs the exhale without muscular strain. The count with pursed lips extends comfortably to 8 or 10 counts on the exhale without effort, because the resistance does the work of slowing the airflow. Studies testing this specific technique in adults with hypertension and in post-cardiac event rehabilitation programs have found systolic blood pressure reductions of 8 to 12 millimeters of mercury after 6 to 8 weeks of consistent daily practice. That is equivalent to the effect of a standard low-dose antihypertensive medication, without the medication, without the side effects, and without the cost. Now for sleep. The intervention is nasal strips or, for those who are ready, medical-grade mouth tape. A 2021 paper in the Journal of Clinical Sleep Medicine found that simple external nasal dilation, using an adhesive strip across the bridge of the nose to open the nasal passages, significantly increased nasal airflow, reduced mouth breathing episodes, and improved oxygen saturation during sleep in adults over 60 without formal sleep apnea diagnoses. The mechanism is straightforward. The external nasal dilator gently holds the nasal valve, the narrowest point of the nasal passage, open against the natural negative pressure of inhalation that tends to cause it to partially collapse in older adults with reduced tissue elasticity. More open nasal valve means easier nasal airflow, less resistance, less tendency to revert to mouth breathing during sleep. For those who find nasal strips insufficient, a small piece of medical-grade paper tape placed lightly over the center of the lips during sleep ensures nasal breathing is maintained through the night. This is not fringe advice. It is used in clinical and sports medicine contexts around the world. Nasal breathing during sleep means 6 to 8 hours of continuous nitric oxide production, 6 to 8 hours of humidified and filtered airway, 6 to 8 hours of lower sympathetic activation, and 6 to 8 hours of the natural slow breathing that occurs in healthy adults. During sleep stages 3 and 4, the deepest and most physiologically restorative stages, where the glymphatic system performs its nightly brain detoxification. If you have diagnosed obstructive sleep apnea, mouth tape is not appropriate without consulting your physician and using your prescribed CPAP or other device. But if you have simply been told you don't have apnea, if you snore occasionally, if you wake with a dry mouth or mild headache, nasal strips are a safe, inexpensive, and immediately effective first step. Start with a nasal strip on the first night, if breathing feels unrestricted and natural through the night. And if you have no nasal congestion, consider adding mouth tape in the second week. Many people report sleeping more deeply, dreaming more vividly, and waking more mentally clear within 3 nights of consistent nasal sleep breathing. The clarity of thought they experience in the morning is not placebo. It is the glymphatic system completing a job it has been prevented from finishing for years. There is one final element that amplifies everything described here, and that is almost never addressed in breathing guides for older adults: posture. Specifically, the forward head position that is nearly universal in people who have spent decades at desks, in cars, watching television, and now using smartphones and tablets. For every inch your head moves forward of the vertical line of your spine, the mechanical load on your cervical vertebrae increases by approximately 10 pounds. At 2 inches of forward displacement, which is conservative for most adults, your cervical spine is carrying an additional 20 pounds of mechanical load with every minute you sit upright. This compresses the thoracic spine, rounds the shoulders forward, and creates a kyphotic curve in the mid-back that locks the rib cage in a position of partial exhalation. Your diaphragm attaches to the lower thoracic vertebrae and to the inner surface of the lower ribs. When your thoracic spine is rounded and compressed, your diaphragm's range of motion is mechanically restricted from above. You physically cannot achieve a full diaphragmatic breath in a severely slouched posture, not because of any pathology, not because of any dysfunction of the diaphragm itself, but because the geometry of the thoracic cage prevents it. This is why people who attempt diaphragmatic breathing, while slouched, often describe frustration, that the belly expansion feels forced or incomplete. It is not their technique failing. It is their posture failing their technique. Before each of your 2 daily breathing sessions, spend 60 seconds in thoracic extension. Lie on your back and place a rolled firm towel or a tightly folded blanket under your shoulder blades, positioned so that the roll sits approximately at mid-thoracic spine level, between the bottom of the shoulder blades. Allow your arms to rest open at your sides or overhead, your head to rest on the floor or a thin pillow, and simply breathe normally for 60 seconds in this position. The gentle, passive extension of the thoracic spine decompresses the vertebral joints, stretches the anterior chest muscles, including the pectorals and intercostals, and immediately creates mechanical space for the diaphragm to descend fully. People who add this single 60-second preparation report that their first breathing practice breath afterward feels dramatically fuller and more effortless than anything they have experienced during previous attempts at diaphragmatic breathing. That improvement is entirely architectural. 60 seconds of spinal repositioning, giving the diaphragm back the range of motion that years of forward head posture had stolen. During waking hours, practice chin retraction, gently drawing the chin straight back, not down, to align the ear over the shoulder over the hip. This is not a military brace. It is a subtle repositioning that, practiced consistently over weeks, begins to reverse the postural pattern that restricts breathing. Combine chin retraction with the awareness to breathe through the nose at all times during walking, during conversation, during activity, and you are practicing breathing correction for every waking hour, not just during your formal sessions. So here is the complete daily protocol, as it should be implemented starting today. Morning, before coffee, 60 seconds of thoracic extension over a rolled towel. Then 6 minutes of foreminus, 6 nasal diaphragmatic breathing. Through the day, 3-breath nasal foreminus 6 cycles at any moment of stress, fog, or fatigue. Evening, 90 minutes before bed, 6 minutes of foreminus 6 nasal diaphragmatic breathing. Before sleep, nasal strip, and after 1 week of comfort, mouth tape. Week 3, shift both daily sessions to foreminus 8 pattern. Week 5, introduce the pursed lip exhale for 8 to 10 counts. Maintain thoracic extension preparation before each session indefinitely. Practice chin retraction and nasal breathing awareness throughout the day indefinitely. This is the protocol. It requires no equipment beyond a rolled towel and a nasal strip. It costs nothing. It has no side effects. It is the restoration of the breathing mechanics your cardiovascular system and your brain were designed to operate with, mechanics that have been gradually eroded by modern posture, modern stress, modern environments, and the universal assumption that since you're still breathing, you must be breathing correctly. The heart and brain of a 70-year-old who has practiced correct breathing for 1 year are functionally younger than those of a 60-year-old who has spent a decade chronically overbreathing through the mouth in a slumped posture. Heart rate variability improves, arterial stiffness decreases, diastolic function recovers, prefrontal blood flow increases, inflammatory markers fall, lymphatic clearance deepens, morning mental clarity returns, exercise tolerance expands, And the fatigue that felt like an inevitable tax of aging turns out to be a refund waiting to be claimed. You breathe 20,000 times every day. You have been breathing for over 6 decades. Every single one of those breaths has been either building or eroding your cardiovascular and cognitive health. The remarkable thing is that the account is not closed. The endothelium regenerates. The vagal tone recovers. The diaphragm strengthens. The C-Otwo sensitivity recalibrates. The body is not waiting for you to be younger. It is waiting for you to breathe correctly. Starting with your next breath right now, you can begin.